I cornered my old friend, Dr. Evan Cohen, and I'm asking him about his practice. What kind of medicine did you practice, Evan?
Cardiothoracic surgery.
You opened people up, did something with their hearts.
Yeah, something like that.
That's cool.
Yeah, it's pretty cool. It's pretty
Did
cool.
did a lot of your patients have or need Medicare and Medicaid?
Well, most people that need heart surgery, probably over 50%, a good number over 50% were over 65 years old. So,
Yeah.
a fair number had Medicare.
So a lot of them had Medicare.
Yeah.
And what about Medicare Advantage? Do some of them have that?
Yeah, some of them had signed up for Medicare Advantage plans, So, so the deal is, especially if you watch TV nowadays, especially all these commercials, they tell you that if you're over 65, you have Medicare, that you might qualify for these Medicare Advantage plans
Yeah.
that will add dollars to your Social Security check.
Huh.
And not only that, but they'll have dental plans and drug prescription plans and all that.
All very complicated.
Yeah, and that these were all you know incredible offers. And I hate to
They
say it.
advertise the heck out of
Yeah.
Medicare
Oh,
Advantage.
oh,
It's
oh,
true.
for sure.
That's
And
why they sell so much of it.
and but the truth of the matter is, if it's too good to be true, it probably it's probably not true. And we took care of a fair number of patients that would have Medicare Advantage plans. And the problem is, when push came to shove, their insurances would not cover lots of their costs, lots of
Wow.
their care. I can't tell you how many patients we would take care of that would say, "Oh, I have the best care," and then after surgery, they might need physical therapy or might have to go to a rehab hospital or something like that. And then we'd say, "Okay, well, we'll have the social worker kind of go over, all the details and contact your insurance." And almost uniformly, the response was, "Oh, don't worry about it, Dr. Cohen. I've got the best coverage. This is the best deal, and won't be an issue." And then we'd go back the next day and say, "Well, actually, it is a problem because your insurance won't pay for this care."
But it
So,
said it would when they bought it.
Yeah.
They thought they were going to get everything
Yeah.
and a little more.
Yeah, that's exactly right.
Okay, so that's the lowdown from a real doctor
Yeah.
about Medicare Advantage.
Yeah. Um, if possible, I know what I do personally is take Medicare, traditional Medicare, and you buy a supplement.
Yeah.
I mean, for sure, it's a lot of these, it's not so cheap, but healthcare is not cheap.
Yeah.
And
Not in America.
yeah, and it's even worse when you're told you need a certain kind of care, and then you find out that your insurance is not going to cover it.
Yeah.
I mean, that kind of, it hurts.
The essence of the problem is this: you're not when you buy Medicare Advantage, you're buying insurance that the actuaries have figured out, what's worth what, and what the risks are and all that. Plus, you're paying for a nice profit for the insurance company.
Yeah.
And so if you don't buy Medicare Advantage, if you do what you said, just get Medicare and then get additional coverage, Medigap,
Yeah.
then you're much better off.
Yeah, I would think in general that's the case.